need to clean my earpieces and my diaphragm. And this is another one of those things that if they go too far, the evaluator is going to say stop, clean your earpieces. They'll get a ding for it, and but you know they can continue on. But they will wait until right before they get ready to put them in their ears. I mean, it'll be like stop. You know, giving them every opportunity to get it done. So we will be sure they get that done. Okay, so we've got all of our earpieces done. Get kind of dry here, so I'll get another one. Clean that diaphragm good. Okay. Now, I'm sure you know this, but anticipate the kids not knowing how to put these in their ears right. And we want to set them up for success on this one, because anything we can do to help them get a good reading, that's what we want to do. And you've got to start by getting these earpieces in the right place. And I think there's a little video on Moodle about this, or a little PowerPoint or something about this. But the ears, as you know, the ear canals are like this. So we have to put the earpieces in like this, so that the tips of this is pointing away from them toward their nose. And get it in good. All right, Ladybug. Let me see this arm here just a second. Palm up, and I'm going to feel for the brachial. And there's lots of different ways to go about it, but just be sure that they are indeed feeling for the brachial. Because what does that step say? Now, if they're feeling, but they're over here, they're not going to get credit for that step, because it specifically says to feel over the brachial. So they may come back to you and say, well, I was feeling for it. No, you weren't, because it's not over there. It's over here. So they actually have to feel where that brachial artery is, or where it should be. And please tell them that in some people, you know, they're not going to feel it right off. And if they don't, as long as they're feeling in the right place, just move on. And I'm sure you do, but when they come to testing, they get a little nervous about that. Okay, so we felt for it. We're going to put our blood pressure cuff on. We're going to put this arrow over where we felt the pulse. Now, this is another spot that is so simple, but students make it hard on themselves. They try to stay here and put a cuff on. If they come on up here and get that arm at shoulder level, look how much easier it is to put that cuff on. You know, it's such a simple thing. You and I can slap it on anywhere, but they don't have that life experience yet. So tell them to come on up here for testing purposes. Come on up here, get that shoulder, get that hand at shoulder level, and then they have more room to manipulate that cuff. Okay. And actually, I'm going to take this pillow. I could just hold it up there and take it, but to help your students be successful, think of anything that might give them a problem. And the problem might be that their arm go like this. And it's got to be supported, so we're going to put a pillow up under there. Now, y'all, that looks pretty good, don't it? Mm-hmm. I mean, that's what you call setting yourself up. Okay, so, and then the evaluator's going to be listening in.
Don't do this if you're the patient.
Yeah, don't do that if you're the patient. You can also unclamp this and put it anywhere you want to. As an evaluator, most of the time I will unclamp it if they don't, to be sure that both of us can see it. Or we may just lay it down. Okay. Are you okay with it there? You okay with it there?
It's upside down.
Are you good there?
I'm there.
Okay, I'm good. Okay. I'm good if you're good. Do not pump it up above. You want to pump it up between 160 and 180. And then drop it slowly. Did you get it?
Got it.
Okay. Alright, so I'm gonna write down, shoot, I forgot the bottom number. I ain't gonna guess. I ain't guessing. Yes, ma'am. I got 4 tries.
Oh.
I forgot my number. I'm gonna listen again. I ain't gonna guess. Pump it up to between 160 and 180, but no further. Okay, did y'all see what I just did?
Should have washed your hands before you recorded everything.
I sure did. See what else I did? You're exactly right. You are exactly right, because this is definitely a touch one. Gotta wash my hands first. If they're not sure, you reinforce to them that they got 4 attempts.
I thought they only had
It
one
said-
attempt on blood
It
pressure.
said twice from the summer conference.
Twice on each arm. Got to finish the sentence there.
Oh.
Twice on each arm.
And then for pulse and respiration,
Doesn't matter.
it doesn't matter, there is no number.
There is no number.
Okay.
You're exactly right.
What was it,
Twice
by the way?
on each arm. I got 124 of 86. What'd you get?
I got 180 over 70.
118
Mhm.
over 70?
Yeah.
Okay. Alright, let's think about this, y'all. She got 118 over 70. I got 124 over 68. So what's the difference in 124 and 118?
6.
6. Okay. What's the plus or minus on this one? 8. So am I still okay?
Mm-hmm.
I'm okay. Alright. 68 and 70, what's the difference? 2. So am I okay?
Yes.
Yes. Some teachers say, well, that's an awfully big plus or minus. And I say, yes, but it is to your student's advantage. Because if you really want to get equal here, you better test her hearing and test my hearing. Because our hearing is not the same. No two people's hearing are exactly alike. So that 8 points gives you some variable for hearing. I'm going to say it's for hearing, but as far as technique goes, you better be able to nail it the best you can, so that if there is that much difference in hearing, that it doesn't become an issue. Does that make sense? So if they are not sure, tell them not to write anything until they are sure. And good call on me not washing my hands. Excellent call. They've got to be washed before you touch that pencil. Okay, now let me tell you what will happen if things go awry. Let's say it had been a difference larger than 8. If the difference is larger than 8, the evaluator is going to allow the student to go ahead and finish. Let me take this off your arm. To go ahead and finish. Oh, I'm sorry. That's okay. They're going to allow them to go ahead and finish the skill. Get all the way to the end, wash hands, put everything up, open the curtain, blah, 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 capiche, done. Then they will stop the clock. They will retake the blood pressure in whichever arm that they got the recording in. They may have been over here and then went over there. But if they ended up over there, that's where their evaluators are going to go.
The last arm they used.
The last arm they used is the one that they're going to take, because we have to get a clinically acceptable reading. Now, sometimes the evaluator will get a reading, the candidate will get a reading. And you heard exactly what you heard. You have no questions about what you heard as an evaluator. But if the placement was wrong, if they just got lucky and the placement was wrong, that evaluator can recheck that blood pressure. So what I'm saying is, it's possible for them to go through all the student to go through all the motions, put the stethoscope in the wrong place, okay? Therefore, they already got an error because it's not where it should be. Then the evaluator recheck it after the whole skill is over and get a much different number because their location was not good, but the evaluator was right on it. Does that make sense? All that to say is, they can't just say any old wear on the arm, I'm feeling for the brachial. You know, they'll do it. They'll be feeling everywhere. It's just amazing. The brachial is on the pinky side. It will always be on the pinky side. It's always going to be there. Either between the middle or this side, but it's going to be on the inner aspect if you're in anatomical position. And I know that that's too much preaching on that, but they've got to know to put it in the right place. Okay, so you know what to expect if there's a difference. What's going to happen? They're going to what?
Recheck it on that last one.
They're going to let the candidate finish so they don't break their flow. When they get to the end, they'll stop the time, they'll recheck it, and then they'll record. But the candidate will never know what the evaluator got. They should never know what they got. Okay, any questions on blood pressure?
Is that 8x11 sheet, or is that their own notepad that they're recording on?
It's that 8x11 sheet. And that's the only purpose in that sheet is to record. Now, some evaluators, myself included, I will put notes on that sheet. Like I will write on that sheet the exact skills that they're going to do. That's because I may not can remember that form number 32 is this, 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 and this. So I'm going to write what form number 32 is on that piece of paper so I can pre-screen them. So if I see I got a blood pressure coming up and that person is twice the size that I am, I know that's not a good patient for them. So I can kind of do some screening because I know what's coming up. But as far as the student's concerned, the only reason for that piece of paper is to write that result, hand it to the evaluator.
Is it on the central supply table?
No, it's with their papers.
Okay.
There'll be two pieces of paper that the evaluator has. They'll have a score sheet, and then they'll have a measurement sheet. The score sheet is where they're just checking yes, no, yes, no, yes, no, yes, no. And then the measurement sheet is where they're going to give it to them and say, put your results here. Two pieces of paper. All right, so we're going to take this off, and I did not wash my hands, y'all. That is so bad. I didn't wash my hands. Do it before you record. Put that right there. Throw all this stuff away.
And they put in both sets of earpieces, right?
Technically, the evaluator can clean their own, but most people will go ahead and clean them both. Theoretically, no, but yeah.
I had one student ask me yesterday, she said, on my dual stethoscope it has two different types of earpieces. What if she picks up mine? I said, well, you just ask her nicely. If you don't mind, can I use that side?
Sure.
Yeah. I was like, so if that's going to make the world of difference in your reading or hearing,
That's right.
she's not going to say no, I don't think.
I don't think they would.
No. Yeah, they just get fixated on a certain way.
Yeah.
Does the student ever see the reading that you got?
No, they're not supposed to. The evaluator should handle it in such a way that they don't see it.
Tristan Kiever, please report to
And
Ms.
here again,
Cable's room.
you want to remain as neutral as you can possibly remain.
So none of the measurement skills should be something the students see the results of.
No, they should not.
Because they will be freaking out.
Correct. Absolutely correct. And that's one of the reasons why they don't want to see it. Because they really may be doing okay. And they may have, let's say it was a blood pressure and they missed it by 6. And they forget that they have an 8 variable and they think it's too far. they can send themselves down to 2 right quick, and they were really passing up until that point. So I'm gonna wash my hands, I'm gonna open the curtain, and we're done with that. Any questions?